Hello everyone, this is Christine, your local school nurse. I wanted to take a moment just to shed some light on a situation that has affected our community. Some of you may have children in school or know of children that were affected by this, but recently we had a salmonella outbreak at the local elementary. Some of the children had symptoms such as diarrhea, vomiting, nausea, and then a fever. The reason that we're suspecting that this outbreak happened was due to either some contaminated food or some contaminated water. Usually that's the way that the salmonella is spread, also known as food poisoning. Salmonella is a type of food poisoning because it normally comes from food or water. Now, the way that individuals get this is by eating undercooked food or by drinking contaminated water. Sometimes if we don't wash our hands with soap and water for at least 15 to 20 seconds after we use the restroom, it can also be transmitted that way because it does live in the colon. Now, I just wanted to or educate you all a little bit, just in case you didn't know. Salmonella food poisoning typically is not like a life-threatening type of an illness. Normally what happens is in the healthy individual, their immune system takes care of it. Usually the biggest thing is dehydration, just because of all the diarrhea that's associated with it. Your body is trying to get out the bacteria, and so it's going to do it in which way it can get it out the fastest. So usually that's by diarrhea, sometimes vomiting. So because of this, dehydration can occur. If you or a loved one has these kind of symptoms, you just want to make sure that you stay hydrated. You replenish your water, you replenish your electrolyte, and that way your body is able to fight it off even quicker. Now, sometimes in our population, there is individuals that are more susceptible, as elderly, small children, infants, immunocompromised. So in that case, you really, really want to make sure you stay hydrated. And sometimes it's necessary just to seek medical attention to make sure that you don't get furre sick. If for some reason that you have the salmonella food poisoning and you are having bloody diarrhea or just a really high fever, it's not going away, it's been 5, 7, 9 days and you're still having that diarrhea, you need to seek medical attention. Typically, we'll see the symptoms start about 6 to 72 hours after ingestion of the contaminated food or water. And then usually it'll only last about 2 to 7 days. So if you're outside that parameter, then you're definitely going to want to seek some medical help. But like I said before, normally the body handles it. Just as long as you keep hydrated, you should be fine. Some other things that can cause the salmonella poisoning is farm animals, turtles, pets. So just make sure if you're with them or you're petting them a lot, just make sure to wash your hands with soap and water. For any other questions, you can always get me at the school. We are taking every measure to make sure that everyone is safe. That's our priority, is safety. Make sure everyone is well. If you do have any questions, you can always contact me. You can always go to the Center for Disease Control or the World Health Organization for more information on salmonella if you're interested. All right, y'all. Have a good one. Bye.